This demonstration we're showing now will be the finger splint. We call this the trouser splint. The measurement for this would be, for length, these two fingers are going to be incorporated in my splint. So this is what I want to measure. The length of the third, coming down right here to the wrist, pocket of the wrist, right here, the base of the wrist here. That's my measurement for length. And my width will be determined by taking this 3-inch elastic bandage, coming around the second and third. If it touches, 3 is fine. If it didn't touch, I would it's up to 4. But 3 will be good for her hand, or finger rather. Okay. Now what I do on my smaller pieces here, because this is pushed back in, it's really bunched up here. So what I recommend is just open it up and just flatten this out on your smaller pieces, and then get your measurement. Cut it off, push it back in, into the box, bring your door down till your fingers feel it, slide your fingers out, reseal, make sure that red line is gone. Okay, stretching the edges over the fiberglass. Remember that now. Over the edges, protect the fiberglass. Stretch. This side here, stretch it. And again, as an option, you can open it up, cut that away. Placing it back on the patient. Right here in the west space of the finger, the third finger here, make a little pinch. Right there. Here's my little pinch. Now here's my mark. Open up the double face tape and just separate the padding. And here's my mark. So what I want to do now is take this out. Fold the fiberglass in half lengthwise. Here's my pinch right here. I'm going to come in about 1/4 of an inch into the product from the bottom. I'm going to cut all the way up to that pinch I made. Okay, and now I'm going to hang it right, removing that strip. And that's going to give you my, what I called earlier, my trouser look. That's why I call it my trouser splint. And I place it back in my padding, close it back down, make sure all your edges are protected still. And then right here in the middle, where it's only padding, I'm going to cut up the middle, just the padding. So now all my sides are protected. Okay. Now I'm going to wet this a little bit on this leg and this leg. Fold that and just squeeze it one time. Push that water through. And then roll in your towel. Again, it's very important to remove the moisture from the splint so it goes on fairly dry, so you cut down on your skin maceration concerns. Now you want to always pad between the fingers you're going to incorporate in the splint. The second and third, we're just going to pad between that. Now taking my splint and coming between any finger you want to do. Okay, we're doing these 2 fingers here. Just capture those 2 fingers. Now you can use cling, you can use a co-adhesive bandage like a Co-Band, or you can use a 2-inch elastic bandage. Just support it at the wrist and come up to the tips of the fingers and just come around the tip once, around the middle of the finger, around the back, one more time through the web space, and then finish it at the wrist. Again, if you were using a cling, you can cut this in half. Or if you're using a regular bandage without Velcro, you can cut it anytime you like. And now we want to position this. Now you like to position it down to probably position of function. 45 degrees of flexion will be acceptable. Again, always check with the physician as far as positioning goes, but this usually is acceptable. And I do like to show another taping technique because most cases you may be using aluminum splints to do a finger. And I find aluminum splints, they tend to play with them. They bend all the time. And it always will. So what you want to do is just use this technique and just taking some tape and just in the middle, come down, crisscross around the back, and here in the middle, little turnbuckle effect. See how that brings the fingers down? And that will maintain that for you. Okay? Now it's not attractive, but it's effective. I find it really holds that patient down. You can leave the room, come back, and the patient's the way you left them and not extended or closed. And that is our finger splint.